For a long time, as women, we were told our symptoms were just something we had to push through, or that we were overreacting. Exhaustion, brain fog, anxiety, sleep problems, pain. In healthcare settings, sometimes those experiences were brushed off, normalized, or simply not talked about openly at all. But for many women, these challenges impact more than just health. They can also affect careers, financial stability, and day-to-day life in ways that are usually overlooked.
All of these things are real issues that people face, but if we can talk about it openly, it's a first step.
That's Dr. Sheila Wijayasinghe, family physician and medical doctor of primary care outreach at Women's College Hospital in Toronto. She talks to our host, Natalie Nanowski, about why women's health concerns are still often misunderstood, why conversations around perimenopause and menopause are becoming much more open, and why women's longevity is something to prepare for, both mentally and financially. She also explains why better awareness and earlier support can make a meaningful difference.
1 in 10 individuals will leave the workforce because of unmanaged symptoms of perimenopause or menopause. It results in a $3.6 billion loss to our Canadian economy.
I'm Armina Lagaya, and this is Perspectives. Now, here's their conversation.
All right, Dr. Sheila, thank you so much for joining us. I'm really excited to have this conversation.
Me too. Thank you so much for having me.
Okay, so first off the bat, I just want to jump right into it. Let's talk about women's health. It's such a hot topic right now. I feel as though women are sharing about topics that used to be taboo, everything from periods to infertility to perimenopause. But you've been in this space and talking about these things for quite a long time right now. How did you get into it? What was that defining moment?
So I've always loved working with women in my practice, and I've been in practice for almost 20 years. And I agree with you. There is a wave of demand for good care and to talk about the things that we never got to talk about before. And I think back to the time that I was growing up and even in my 20s and 30s, that it just didn't land where I was able to actually sit down comfortably with a clinician and get support for the things that I needed help with. Where it really shifted for me was that when I started to care for women in particular in my practice, because I'm a family doctor, I could see the impact of caring for women really impacted the care of their families, their communities, and their workplaces. Everybody's health rose as a result of caring for the woman in front of me. And the challenge is that women tend not to care for themselves. Like, we are the last person on our lists often. And so I became kind of my mission to say, you deserve good care. Let's talk about the hard things, because these are the things that are affecting your ability to show up for yourself in your relationships, if you're parenting, at workplaces, because there's so much that we can do for you when we acknowledge and validate your experience and actually get the care to you that you deserve.
Yeah, I think that there's so much guilt that women feel in terms of caring for themselves. That's probably one area of disconnect that you see when treating women. What's another area of disconnect or some of the challenges women have?
So women historically have been dismissed in healthcare settings. So we are less likely to get care for things like pain. We aren't likely to be diagnosed with things as early. So there's a lot of delayed diagnoses. When we think about things like endometriosis, there's a 7 to 10-year delay in diagnosis. So people are suffering through those years, almost a decade, to get support. We also know that there's very limited research in women's health, unfortunately. So in Canada, about 93% of research in health is done on men, and 7% is done on women's health, and even smaller slivers to the different parts of women's health. So think about that. When we're seeing the studies that we're using to apply, is this medication going to work for my patient? It's actually studies that are done on men, not on women. And as a result, that medication may not be the most appropriate thing, but that's what we're working with right now. So there's a large shift happening in women's health to try to increase research, to try to use the appropriate names, to make sure that we're listening to our patients. But there is a significant gap when it comes to women's health and what we're doing, because historically, women have been left out of the conversation.
Right. Women have been left out of the conversation. There's not a lot of studies done on them. I know historically that was because having a cycle, having your period really threw things off in studies, because there's so many varying factors in terms of hormonal changes. I want to go right now and move into women's health and women's financial health, because there's not always that tie right away that you see between, if someone is healthy and how their finances are doing. Can you explain a little bit about the tie between those two things?
I love this question because whenever I work with my patients as a family doctor, we're always talking about what's called the social determinants of health. So looking at the basics of health first before we move further than that into the specific diagnosis that we work with. So finance is actually a specific social determinant of health. Income is a determinant of health in terms of how well our patients will do. And we have very good studies that show that. Women in particular have worse health overall throughout their lifespan because our health issues start earlier in life. They're more chronic in nature and they last longer, and we're less likely to get help for them. Men tend to cluster later in life in terms of when they present to us. And that's a whole other podcast episode to like, how do we get men to come and see me in the office? But men tend to come in around their mid-40s to mid-50s with something happening in terms of chronic disease management, whereas women are coming in earlier, if they're able to come in, for things like their period health, pregnancy, fertility, perimenopause, and menopause, and that's throughout the lifespan. Those specific health conditions really affect how people function at work. Are they able to work? Are they able to be productive? Because they cause significant morbidity or symptoms that affect their functionality. And so it takes them out of the workplace sometimes earlier on in life, which really affects their financial wellness as well later on. We also know that women are the predominant caregivers in many different settings, and caregiving for family members or otherwise is often unpaid. And so that's something that also impacts financial well-being. And so certainly like women live longer than men by about 4 to 5 years, but we're living in poorer health and we're living in poorer financial states too.
Right. So as you mentioned, women are coming to see doctors for period pain, for instance, and that's also taking them out of the workforce. Then when they move on to their childbearing years, a lot of times that takes them out of the workforce. When they get pregnant, they take a year off to raise that child. But that's, of course, if the process is linear, right? If they have to go for fertility treatments, that adds a whole other layer and that takes them out of the workplace. Can you explain a little bit about those added costs?
There's so many added costs with that. So any pause in work ability results in a direct financial hit. And I see that directly in my patients' lives where then food instability becomes an issue, their ability to support their families, their sense of self changes as well. And again, like you said, it's sort of from a young age that we see this. So endometriosis pain, for example, has been likened to like a heart attack type of pain for some people. It's very severe. And when people are dealing with that, they can't go into work. They can't. And often people are staying home from work because, again, it's an area that's underdiagnosed and delayed diagnosis. So they're not getting the care that they need. So they leave work or they don't enter the workforce. Fertility itself, when we're trying to get pregnant, and like you said, everyone's journey is different. It's not always linear. I didn't realize that myself until we went through fertility ourselves, that I thought it would be easy. And a lot of folks delay childbearing now, right? So this is where we see this. We're seeing fertility. 1 in 6 couples face fertility issues in Canada right now. And the way that it impacts workplaces is that you have so many appointments that you didn't realize that you have to go for. I didn't realize that I'd have to go in 3-4 times a week to have an ultrasound done and blood work done. I would have to delay the start of my clinic. When I work with my patients now that I understand that, I actually am able to write notes for them to sort of say, can we accommodate this? Because they're going to start work at 10 o'clock because they have to be at the clinic at 8 o'clock. But all of those things make it really difficult. And when we're talking about women's health issues, there's still stigma around this. And so a lot of people hide this from their employers because it's a private issue. They're worried about consequences in workplaces if they are found out to have issues happening, and they won't talk about it. And so they're taking time off, they're taking sick days, they're missing work, and that also affects how they're seen at work sometimes. So that impacts their performance and ability to advance themselves as well. So it's just widespread, the effect, and then the effect on mood as well, right? When you're suffering through symptoms, that has a big effect on mood. And I see that very much so in my patients and the effect on their work and their financial success.
Even just talking about it, I think, lifts some of that stigma. Do you think in general that stigma, that taboo around women's health and some of the challenges we face, whether it's painful periods, endometriosis, infertility, perimenopause, do you think that's lifting at all?
I do. And I'm hopeful about this. I'd say early in my career, we were speaking about this in hushed tones, even in medical offices. And because of things like social media, which there are benefits to it, right? Where people feel more able to speak out on topics that we should be talking about openly. We all have dealt with period issues. We have all dealt with these sorts of issues, or we know somebody who has, but we feel really alone in it. And so because of that public shift, it's changing things in our offices as providers, and we're hopefully doing a better job. Now that's hard sometimes because we're still catching up to the public demand, which is important. So I want to encourage everybody to still speak up and talk about it. And I'd say a lot of the work that I do in workplaces, and I have to thank Scotiabank, like I was at a recent talk on International Women's Day, and it was such a beautiful discussion because it opened up the discussion. It was a full packed room and people were listening in online and having conversations about difficult to talk about topics like periods, perimenopause, menopause, fertility, miscarriage. All of these things are real issues that people face. But if we can talk about it openly, it's a first step. And it seems really simple, but it's amazing to see. And having those kinds of talks and openness help everybody.
Mm-hmm. I was doing some digging about perimenopause and menopause and looking at some of the statistics, and I was shocked when I realized that there's a recent study from Pacific Blue Cross that nearly 1 in 10 women had to turn down a career advancement or some sort of a promotion because of menopause symptoms. That stat is pretty shocking. Mm-hmm. Turn down something that maybe you've been working for so long because of how your body feels.
And I see this every day in my office. The area of focus for me right now is perimenopause and menopause, and that stat is real. The Menopause Foundation of Canada also did a similar study, and they found that 1 in 10 individuals will leave the workforce because of unmanaged symptoms of perimenopause or menopause. It results in a $3.6 billion loss to our Canadian economy because of these unmanaged symptoms. And it has an impact not just on workplaces, but on homes and families and communities at large. And this is where we need to do better because it's unmanaged symptoms. And when we start to recognize that there's a lot that we can do for our patients, and this is really one of my goals in having these kinds of conversations, is patients realizing you have rights as patients. This is a time of life that can be difficult, but there's options for support, and you can thrive through this time and beyond. It's a really critical piece to keep in mind. So perimenopause is this time that leads up to menopause being when you've gone 1 year without a period. The average age in Canada is around 51 for menopause, but perimenopause can last anywhere from 4 to 7 to 10 years before that actual change. And it's a time of flux. So it's a bit of a roller coaster because it's predictably unpredictable. There's some months where you're really high in your hormone levels and then some months where you're really low, and that doesn't feel great. And so there can be a lot of symptoms associated with that, the sleep issues, the brain fog, the fatigue, the mood changes. It's not just about your period changing. There's over 30 symptoms that can happen at this time. And you can imagine how that impacts folks in the workplace. And so I see it in my practice because when people come in, and now I actively ask my patients about it because I myself am perimenopausal, so I'm really interested in knowing my patients' experiences too. When we ask about it, and often they'll say, I don't recognize myself, Dr. Sheila. I was motivated. I could get out of bed. I could do the things I wanted to do. And I'm so tired. And I'm so just distracted easily. I forget words when I walk into a room, or I'm in the middle of a meeting and I don't remember something that I was supposed to say. And that has an impact. So we really tease it out and figure out how can we support you, because there are so many great options for support. But again, it goes back to that 1 in 10. Like, that's too many people leaving the workforce. And often people have been dismissed because at this time of life, you're in the middle of caring for aging family members, caring for children potentially, caring for your partner if you're partnered, and managing your workplace as well, because often people are at the peak of their careers. And that's why people like the Pacific Blue Cross study showed that 1 in 10 aren't taking up that opportunity for advancement.
So what are some of these symptoms? I mean, you mentioned some of them: brain fog, tiredness, that we should look out for, because some of these symptoms could just be because you got bad sleep. Like, how do you know when to chalk it up to, oh, this is perimenopause, I should go see my doctor and ask for help?
That's a great question. Often people will say, is there a blood test that I can do? Because they're sold online. So many things are sold online to us at this time of life. And the truth is, if you're in the age range, so if you're over 45 and you're starting to experience changes, certainly it might be very well be perimenopause that you're experiencing these changes with, especially accompanied by the period changes. But it's really a clinical diagnosis, meaning that it's not a number on a piece of paper. It is not something specific that we look for, but it's a constellation of symptoms and how you're feeling. And again, because women have been dismissed so much in the office, we don't believe ourselves with our own symptoms. And often, I had a patient yesterday say, I'm tired, but I'm always tired. And I'm like, okay, let's not normalize what tired is. Let's try to figure out, she's like, I just push through. And how many of us push through these things when we can, again, try to address it? So when we talk about perimenopause, it is a clinical diagnosis, but what you have to do due diligence. So for me as a family doctor, what I'll do is say, this could be perimenopause, but we also have to rule out the other potential contributors to this. So is your iron okay? And specifically, we're looking for something called ferritin, which is your iron store. Is your B12 level okay? Is your thyroid function okay? Because those things also start to emerge at this time of life. We also need to make sure that your cardiovascular or heart disease risk factors are also managed, because that can be a cause of fatigue if something's going on with your heart. And we see the acceleration of these risk factors in midlife in particular. So checking your cholesterol, checking your blood sugar, checking your blood pressure, all important things to do. So it's not just a, yes, you're in perimenopause kind of idea. I wish it was that simple. It's really a nuanced conversation, looking at your symptoms and doing some blood work to rule out some of those other causes that we can reverse. Sometimes in some cases, if perimenopause is starting earlier, so in somebody's 30s and we're wondering about it, there's a role for checking blood work in terms of the hormone levels. And so we will do that. But over 45, we tend to just base it on symptoms and ruling out other potential causes.
I think one of the challenges many women face is just speaking with their doctor and feel like they're being heard, because there still is really that old cloud, like you mentioned, just push through it. You're okay. This is normal. Period symptoms or perimenopausal symptoms are normal. Suck it up, take a painkiller and continue on with your day.
Mm-hmm. Have a glass of wine.
Right.
Go do this. No kidding. A lot of people come and tell me, they're like, well, they told me, no kidding, you're tired. You have so much going on. And I'm like, sure, you have a lot going on. And there may be a reason why this is happening. And we can address that with support and treatment. And we now have great options for support in terms of menopause care that previously we weren't. So 20 years ago, when I was in medical school, there was a large-scale study that came out that basically overnight turned off hormone therapy prescribing, because the study, it's called the Women's Health Initiative, large-scale study. But the cohort that was being studied was in their 60s. But the people who are actually most symptomatic are in their 40s and 50s. And so you can't apply a 60-year-old's data, just like you can't apply men's data to women's health. You can't apply a 62 average cohort age to a 52-year-old. And now we know better, because we've reanalyzed that, we recognize that actually for most people, menopause hormone therapy, which is the mainstay of treatment for hot flashes, night sweats, is very safe if you started at the right time, under the age of 60 and within 10 years of going through menopause. And now we have options. But we're catching up in the medical space. And like you said, in the doctor's office, you're dismissed often. And part of that is that we weren't taught. And so myself also, I wasn't taught. So I had to unlearn what I learned in medical school and residency and relearn how to care for my patients well.
Right, because a lot of those studies, they come out and oftentimes it takes 10 years before it's implemented into
100%.
practice, right? So that's really challenging. And I mean, you mentioned it before, we can't take what's studied on men and apply it to women. Also, we know right now women are living longer. So what are some of the things that they should keep in mind as they age?
So I think there's so much of a push now on longevity. And we hear about we want to live longer, we want to have this, but we also have to think about living longer costs more. And so if we're living longer, and I've just worked with patients in the last couple of weeks who have lost their partners, and they didn't know how to manage their finances because their partner managed their finances. And it's so common, and they're completely lost. We're fortunate we have an income support team at our clinic, and so I was able to connect them, and they are learning now at age 65 how to manage finances. And this is an area that I think we need to start earlier. Ideally, you're going to age really well, but there's medication costs that add up as we get older. There's caregiving costs in terms of if you need some extra support. So these are things that we need to plan ahead for, because again, women do live longer, and it's scary to think about. No one likes to think about being without your partner or having to have these conversations, but it's really important to have these proactive discussions. And I think I wish that we did that more. And I do think it's actually a part of healthcare that we need to blend a little bit more, where we're talking about finances in our healthcare spaces, because it does have a direct impact.
Right. You want to be physically healthy and also financially
100%.
healthy so that you can live longer and in a better state, right?
Yeah.
We were talking about all the stages, the different stages of women's life, right from teenagehood all the way to, 50s, 60s, 70s, and onward. And all throughout those different stages, women are faced with medical expenses or hormonal expenses or just expenses because they're female that men don't face, what are some of these things? I know you refer to it as the pink tax. Can you take us through that?
So there's a lot of extra costs that we face. Menstrual products, for example, approximately $6,000 to $10,000 over your lifespan that we'll be spending on that. When we talk about fertility treatment, it's $15,000 to $20,000 for an IVF cycle right now. And often you need more than one cycle. And so that is a huge cost that's not always covered. Then we have other costs that, like the pink tax. And so interestingly, I have patients who, in perimenopause, especially, we have hair changes that can happen. And so we're using a medication called minoxidil. And it's a topical product that we get over the counter. There's a black box that's for men that is 5%. It's a stronger version. And then there's a pink box, a physically pink box that is 2%. And so it's less strong, so less effective, and it's double the price.
It's like razors. They're the same thing.
Oh, 100%. And so the same thing holds true in terms of like women's designated products. So I always tell my patients, I'm like, get the black box because it's more effective and it's cheaper. Yeah. But people don't know that. And then we gravitate towards that. So that society-wise, like we are the main consumers in society, and there's a pink tax on being a woman. And so there's all these costs that add up. And then all the costs of having to be off work, caregiving, and otherwise that all add up separate from the products that we have to buy to sustain our health.
So what are some of the ways that, women can advocate for themselves, but also for others? How can we support each other through the different stages of life so that, we're being heard and so that these changes are easier on us?
I think it's always important. We're social creatures. And so having these conversations, talking to your friends, to your coworkers, and advocating for each other makes a big difference. I've seen that. I've had a lot of patients come in and say to me, my friend told me that I should come in and get checked out. It's almost like permission giving when you start to talk to each other. It sort of gives us permission to seek help again when we're the last person on our list of support to each other.
And you often just think that your symptoms are normal or they don't mean anything or you're overreacting.
100%. And that's because society has told us that we're overreacting, right? And so this is not okay. And we're not overreacting. You know your body best. You know if something feels off, if you don't recognize yourself, you deserve good care. And that is critical to getting that kind of support, is trusting yourself and knowing that you deserve good care and to feel good in your own body. And so I start that at a really young age with my patients. We start with that when I'm seeing kids in my practice. I ask them directly. We're having these conversations with the 3 or 4-year-olds to be like, what does your body feel like right now? What does that feel like in your body? It's because they need to build that literacy, medical literacy around being able to advocate for themselves in healthcare settings as well. Because again, we're more likely to be dismissed. And so we need to start to just teach that from a young age. And then with teenagers, the same thing, and then onwards. I think also when you come into a doctor's office or you're seeing a nurse practitioner, coming in prepared really makes a difference. You may have about 10 or 15 minutes in a doctor's office to see us, and it's a bit of detective work what we're doing whenever you come in. And so if you come in prepared in terms of tracking your symptoms, knowing the impact, that really helps us do a better job for you. And there's a lot of symptom trackers online. There's period trackers. There's ways of sort of tracking when things are off. I say trackers because symptoms often follow cycles for women. So when we think about premenstrual dysphoric disorder or PMS symptoms, the impact of that is huge and underdiagnosed. Knowing your symptoms ahead of time helps me understand you better and can do a better job for you as well. I think taking somebody in with you can be helpful. So having an ally in the room, there's a huge power differential in medical settings between a physician and the patient. We try to normalize that and make it even, but having somebody else in the room, because there's often so much information given to you as well. I know when we were going through fertility treatment, my husband would come with me, and afterwards, despite me being in medical, like being a doctor, I still would look at him and be like, I only caught like 40% of what was said, because all I heard was that cycle didn't work. And that was where I needed somebody else in the room with me to be able to just have a second set of ears. I think also if something is not working out for you in terms of the care that you're getting, if you don't have a clinician who's listening, if they don't have the training in terms of menopause or care, for example, you can ask for a second opinion. And it's okay to be referred. And that's tricky because there are wait lists and otherwise, but you again deserve to have that option available to you. So patients have rights. And I think this is where a lot of times, and I can't overemphasize this, when workplaces take initiatives like what we did earlier in the year, when we are having these conversations, having these open discussions, people will come and get help because they heard it at their workplace. And that's a really wonderful way to reach people, because then we can actually motivate each other to get that help that we all deserve.
Right. And it takes away a little bit of that taboo for sure. I think right now, women's health is so popular and we're bombarded by so many different routes to take and we're sold so many different gimmicks. And I just wanted, I'm going to do a rapid fire here.
Awesome.
And I'm going to ask you, looking at some of the wellness trends, which ones are you think effective and which ones are kind of a pass that there's, no medical sense to them. So the first one is, what do you think about collagen?
Yeah. So there's a lot of studies on collagen. The studies are mostly done by industries that produce collagen.
Okay.
And so it seems to help a little bit with the skin and the joints. But the challenge with collagen is that when you ingest it orally, it gets broken down. And so what the benefit seems to be is that you're increasing your protein intake, but not necessarily the collagen. And so we have to use some caution. Collagen products are really expensive. And most of the studies at this time are done by the folks who produce it.
So it's not going to fix your skin, your hair, your nails?
Some people say that it does, but I would use some caution. I would focus on the other things that really do, like sunscreen, getting enough protein in your diet, and getting sleep.
Okay. Well, the next one, protein. What do you think? Is it 100 grams? We're being sold now that it's 100 grams for...
Like how many chicken breasts in a day, right?
A lot. I think 3 maybe.
Yeah, I think it's 3 or 4. Yeah, it's a lot. So 100 grams a day equates to about... So the recommendation for protein has gone up over time. And right now it's around 1.2 to 1.7 grams per kilo of body weight. Mm-hmm. And so the 100 grams sits kind of nicely for those anywhere between the 60 to 80 kilo range. That's a lot. Mm-hmm. And so I think protein's really important. And so it's a good number to aim for, but realistically, a lot of people aim for 0.7 grams per kilo as a starting point, just to be realistic. What you can get in, just be cognizant of it, and then build from there. And the reason being, it's mostly important, especially in midlife, because this is when we start to notice our lean muscle mass shifting. And that's important for our bone density, for our ability to mobilize, especially when we think about longevity. We want to be active. And so that's where that protein number comes from. Ideal if you can get it, but it is a hard one to hit. And I always say, I'm a mom of 2 young kids. I need to make things easy for myself. I do a protein powder.
Oh, yeah,
me too. And I think a lot of people, and I have some protein shakes that I just take with me to work when I'm running out the door and I grab it. So finding the things that are easy to do are more realistic. And also 100 grams all at once is too much all at once. We have to spread it out throughout the day. I know I like a good to-do list and checking off, okay, protein 100 grams would be great to do in the morning, but it's too much. You have to kind of split it up into 30 to 40 grams at different points throughout the day.
I can't imagine eating 100 grams of protein right in the morning. That would be really, really hard. How about fiber? We're also told right now that 30 grams of fiber should be what you are hitting on a daily basis.
This is an A+. And we do not. I love fiber. Okay. I think fiber is underrated. Fiber is not just about your gut health. Fiber, the goal is to aim for 25 to 30 grams a day. And that's a hard number to get. Most Canadians do not get enough fiber in their diet. We probably hit about 10 on average. The reason being is not just to poop better. It is because it feeds your microbiome, which is a really complex network of bacteria in your gut. It also regulates your blood sugar. It helps you stay full, and it also reduces your risk of colon cancer. And it also helps with cholesterol. So fiber binds cholesterol and helps you reduce it. So when I'm seeing a patient and their cholesterol levels are high, we'll talk about fiber. And so fiber has multiple different uses. We always, most of us, start at around 10 on an average day. So we want to start slowly build it up. Otherwise, you can get really bloated. But there's not a lot of supplements that I recommend because there's very little evidence for many of the supplements that we talk about online that are being sold to us. But sometimes we do need a little bit of a fiber supplement or psyllium supplement to help get us into that range, just to have a healthier outlook. And we see colon cancer is increasing, especially in young individuals. Right. And this is an important way that we can try to prevent it.
So the next one then is water. 3 liters of water. Is that even achievable, feasible?
That's a lot of water.
It is.
Yeah. I mean, if you're having a lot of fiber, you do need water. Otherwise, the fiber sits in your gut like a rock. So you do need some water also. But that's a number that is quite high. And we have to think about water intake as all of your food. Foods also count towards your water intake. So when you're having fruit and veg, that counts towards your water intake. We don't want to overdo it. I would just sort of aim for a lower number because that's a lot of peeing that happens after that number. Water's great. Most of us don't drink enough, but everyone has their large, giant water bottles everywhere with them now. And it's good, but That's a pretty hefty number. I would think about all your sources of fluid, including tea, coffee, that all counts towards your water intake.
Okay, that's good to know. It makes it a little bit more manageable than I don't know, but I've just been sold this 3 liters of water a day. It just sounds like a lot.
Who has time to go to the bathroom that much?
Yeah, I know. It's interrupting work. Okay, last one, vitamin D.
Yeah, vitamin D is really important. It's one of those things, depending on where you live in the world, but certainly in Canada, we do not get enough vitamin D. It's from the sun. Even if you're outside in the sun enough, it's just one of those things that we don't get enough of, especially if you have darker pigmentation in your skin or more melanin. It's harder to absorb it. And so vitamin D is one of those supplements that I do recommend in Canada because we don't get enough. And it's important to take the appropriate amount. So osteoporosis.ca is one of my favorite websites to refer to. They have a calcium calculator and a vitamin D support tool.
Oh.
And you can go on there for free. And you can calculate how much calcium you need in a day based on ideally you get enough through your diet, but if you don't, you can supplement up. And it shows you your age range and how much to get. And then your vitamin D, it also tells you the recommendations on there based on your age.
Okay. Thank you so much. I think we're going to have to leave it there for today, but this has been a very insightful conversation, and I hope it's going to give women some confidence to speak up if they need to.
Thank you so much for having me.
The Perspectives podcast is made by Ryan Clark, Natalie Nanowski, Ned Kelly, and me, Armina Lagaya. For a transcript of this episode, as well as other stories, videos, insights, and thought leadership, visit our website, scotiabank.com/perspectives. We'll see you next time.